Yes, okay. My name is Karen Thrasher. I am one of the instructors here at the Physician Assistant Program at Upstate. Again, I want to let everybody know that Maggie Moore is on from admissions, and there are 2 students who will be here in this, as well as go to the student panel. Lindsay Pohe, I hope I said that right. Did I, Lindsay?
It's Poje, but that's okay.
Poje, and Jason Lamb, I believe he is on this as well. So at the end of this, we will take questions that you can ask the students and questions that you can ask me. Let me give you a little bit of background about myself. I have been a PA since 1994. I graduated from Gannon University in Erie, Pennsylvania, and my career has been agency medicine and outpatient internal medicine at the Syracuse Hospital. And that I joined the PA program at Upstate for teaching in 2013. So I have been with the program 7.5 years now, and I enjoy every bit of it. So I'm going to go through talking about the program itself and then field any questions that you might have throughout this. Hang on a second, I guess I have people that want to join this. Okay, so here goes. I'm going to share. Okay. Can everyone see that PowerPoint?
Yes.
Okay, thank you. All right. Okay, so I leave it in mode. I'm not going to put up the whole screen. Jason and Lindsay, if you happen to see some questions come through and I don't, please let me know. Interrupt me if you see a question come right up. So let's get into talking about PAs in general. So PAs are known as partners in healthcare. We work in a team-based approach with physicians. We're going away from using the word as a supervising physician, as we are more collaboration with a physician. We work in autonomy, so we are allowed to have our own patient panels and take care of our own patients based on our education and how we're taught. But we always have the realm of a supervising or collaboration with a physician with us. It does not mean that that person is on site with us. You can practice in a clinic and the physician be at another hospital or another location, or only potentially come in 1 or 2 days a week while you work 5 days. So know that you really do have autonomy and you really do take care of your own patients. When I worked at the VA, I had a patient load of 1,000 patients that were my responsibility. They were attached to my name, and I was the one who took care of all of them. To be a physician assistant, you have your healthcare professional who practices medicine under, as we said, a supervising physician. We're nationally certified through the NCCPA. We have a state license in whatever state that you happen to choose to work in. And again, exercises autonomy in medical decision-making and provides broad range of diagnostics and therapeutic services. A little bit about the history of physician assistants. The first original program started at Duke University in 1965, and they graduated. They started with 4 students and graduated 3 in 1967. And it came about that the reason why we started PA programs is there was a shortage of physicians, and specifically there was physician underrepresentation in inner cities in rural America. I'm going to try to see if I can show you this video. Give me feedback, those of you who are on this, on whether or not you could hear it. Can you hear it?
No, we can't. We don't see the video.
Yeah, okay. So let me stop it. I'm not a master at sharing this stuff. That's the problem. All right, let me go back to my PowerPoint. Can you see my PowerPoint?
Yes.
Okay. All right, so let's just keep going on. But there is a video if you go to YouTube and you look up physician assistant history. It's about a 5-minute video. It will talk to you about how this profession started and how it has grown in the 50, almost 60 years that it has been in service. So as of right now in 2020, there are 254 physician assistant programs throughout the United States. And the Federal Bureau of Labor Employment of Physician Assistants is projected to grow 31% from 2018 to 2028, much faster than the average for all other occupations. As demand for healthcare services grow, physicians need to provide care to patients. And this was taken from their statistics of May of 2020. And again, our education growth is imperative to meet these demands. So that's why there's more and more programs coming about, because we're needing to be putting PAs out into the workforce. So what does the education look like? Well, it's a medical model. The curriculum is analogous to the medical school, and it's very structured. It's competency-based, and it demonstrates that team approach of supervising MDPA viewed upon team with a common goal of providing the best quality healthcare that we can. So saying this, I can tell you that by doing this, it is very, very rigorous. Your didactic year starts in June and goes until the following July. And in that 12, 13 months that you are in school, it is very, again, I'll use the word rigorous. It's nonstop. You have breaks in there, but they're not typical breaks like you would get in undergrad. And it is a lot of information is processed and given to you in that short period of time. When you start clinical rotations in that second year, you are equivalent to where a third-year medical student would be in their education. And we always use the analogy in PA school. It's not like drinking from a faucet. It's like drinking from a fire hose, the amount of information that you're given throughout that time frame. So these are just some statistics. This was taken from PAEA, a certificate, which is an educational forum for PAs. In 2017-18, their report showed that the average length of programs was 27 months. The average student was 25.4 years. The average healthcare experience was 4,000 hours, with almost 2,300 being direct patient care and 747 of those hours being in other healthcare experience. The average GPAs in science were 3.51 and overall were 3.56. So for our Upstate PA class demographics, I have some stuff through 2018's class, and then I was only just given recent access to the class of 2022 that we just took in. So I'll show you what I have. So I don't have all of the data, but I have enough that will get a point what we're looking at. So from 2013 to 2018, the classes that we've had. The other thing you need to remember, this program started in 2009, I'm sorry, and the first graduates were in 2011. So the average age is 26 years old with about 2,900 hours of healthcare experience. The science GPAs of 3.32 and overall at 3.46. And then this breaks it out based by the class. What was the average age of matriculation? The average hours of healthcare. Notice with the class of 2013, they had a lot of healthcare experience. That class specifically had a lot of second career people coming in. There wasn't a lot of someone just finishing their bachelor's degree and just getting their hours necessary. These are people who had been working as a nurse, working as a respiratory therapist, working as a radiation therapist, were coming into this program, so that's why the hours were much higher. Average science GPAs, cumulative GPAs. This shows you the region of origin of where we're getting our students, how many kids are coming in from rural communities, from central. So central, for those of you who know the map of New York State, central is along I-81 corridor. So that's be south down by Binghamton, running up through Syracuse and going up towards Watertown. Downstate is going to be like Westchester County and further south down into New York City. Upstate is going to be considered the Albany area. Okay? So from the class of 2022 who just started this program, actually 3 weeks ago, we're into our week 4, correct everyone? Yeah, we're into week 4. So they just started, as I said 3 weeks ago, their average GPA was 3.57. Their average science GPA was 3.53. The average age of the students were about 35.6 years old. Underrepresented students constitutes 31% of the class. 30% are from rural, 19% are from downstate. The 2 most popular undergraduate institutions were SUNY Binghamton and RIT, and we have 3 students in that class that did bachelor's at SUNY Upstate. The most popular way that they're getting their hours were as nursing assistants, CNAs, EMTs, medical scribes. And some other experiences were medical assistants, cardiac rehab specialists, sonographers, medical imaging, phlebotomy, surgical tech, or cath lab. This breaks it down by the counties that people came from, downstate, central, upstate. Okay. Let's see where to go. So let's talk about our program as a whole. We have a very specific mission statement, different than a lot of other programs. And that is that we're looking to educate highly qualified physician assistants with patient-centered values who practice medicine confidently and ethically by demonstrating academic excellence and clinical competence. And our emphasis is on serving the medically underserved populations in upstate New York. And we seek candidates who will assist us in fulfilling our mission, which involves serving these communities. Preferentially, we will be giving qualified candidates who originate from these areas. So we look to try to recruit into our program students who are interested, who are coming from rural communities throughout New York State, whose goal is to go back to those rural communities and be able to give healthcare there, because we know that there is a lack of healthcare in these rural and inner city areas. So going into the curriculum, so the class that just started here 3 weeks ago, this is what they're doing over the 8-week session, which usually starts in June and then sometime around the end of July. They're doing human anatomy. They're taking professional issues 1, which talks about how it originated. It goes through the history, talks to you about credentialing, how to get your license, what do you have to do in order to keep your certification. Population medicine, we break it down into all different populations and how we need to give them care, from children to women to LGBTQ to African American to Asian American to Alaska Native, Native American. We break that down. And then you also take EKG interpretation. In the fall, usually when the summer semester ends, you have about a 3-week break. We start at the end of August and we go for 15 weeks, which is just about the week before Christmas. And during those 15 weeks, you will be taking general medicine. General medicine is broken down into systems. And in conjunction with that is physiology and pharmacology. So whatever you're learning in medicine, you're learning that same in physiology and pharmacology. So for example, if we start out the semester learning hematology, oncology, you're learning the physiology component to that and the medications that go along with it. Same if we move to neurology, or then if go to infectious disease, whatever we're doing, try to keep those 3 classes synchronous with each other. Interviewing and documentation at the bottom, that's how we learn to take a prior history, whether we're taking a complete history for someone we don't know, or whether we're doing a problem-focused history on just a very specific problem that someone's coming in with that. And in conjunction with that class, you take physical diagnosis, which is how to do a physical exam. And we start with as basic as vital signs, all the way through head to toe to ending with neurology. And we continue that right on throughout that entire semester. And then in diagnostic studies, that's where you're learning about all of your labs and why we order labs and what we do with those interpretations once we have them back. In spring, which usually starts the first part of January, so you have off maybe 2.5 to 3 weeks between Christmas and New Year's. Most of the time we start right after New Year's. We're not a typical bunch where we wait until January. We usually start fairly early in January, like I said, right after New Year's. And again, for another 15 weeks, you're going to continue with general medicine 2, pharmacology 2, and physiology 2. And again, they all focus off of one another. We'll do a semester of behavioral science, so we will learn to talk about empathy, and we will learn to talk about death and dying, how we're taking care of our patients, how do we deal with difficult patients, and then we go into learning about mental health conditions. You will do a research design and evidence-based medicine class, which consists of reading journal articles, learning how to summarize those correctly in preparation for your master's project, and then advanced physical diagnosis is we work more on the problem-focused complaint. We do a section of MSK, which is musculoskeletal, learn all of the different testing to test a shoulder injury, a knee injury, hip, back, elbow. And then the second half of the semester, we learn how to do problem-focused based on a condition. So someone comes in with abdominal pain, what are we going to be looking for? What kind of review system questions do we need to ask? What kind of physical exam component is important with this? And that's what we learned in that class. In summer session year 2, you have a 4-week session where you will do all pediatric. It's like pediatric gen med, but it's focusing just on things that happen in childhood. We'll do professional issues 2, where we actually get into talking more about what you need to know going on rotation. So we'll talk about credentialing, we talk about billing and coding. We debate certain projects or certain issues that are going on in the PA workforce, and what do we think about those, and how are we going to incorporate that into how we're teaching our patients. You do an online infection control class, and then you begin the start of a 3-series class on writing your literature review paper for the master's clinical research. In summer session year 2, which is what Lindsay and Jason are in right now, this started the same Monday that the new students arrived, and they are 8 weeks in general medicine 3, and we focus on 4 topics in general medicine 3. It's emergency medicine, general surgery, OBGYN, and geriatrics. Pharmacology is matched up with that as well. They then will do clinical decision making, which is done with our simulation equipment that we have in our department. And then clinical procedures is a totally hands-on class where they will learn ENT skills, such as taking a throat culture, cleaning earwax out of ears, NG tube placement, Foley catheters, casting, splinting, suturing, draining abscesses. We have lots of hands-on, lots of fun time with that, getting prepared for clinical rotations. Then you have about a 3-week break at the end of that second year summer session, and you're getting ready during those 3 weeks to head out on clinical rotations. In the fall, year 2, from August to December, you will complete 4 clinical rotations, and you finish writing your master's paper. In the spring, which goes from January to April, you do 4 more clinical rotations, and then during that time on callback days, you will do a poster presentation of your paper. In summer year 3, May through August, you finish up the last of your 3 clinical rotations, and then you get through the competency testing needed in order for us to say you graduated from the program to then be able to sit for your boards. Here are pass rates. I don't have for the class of 2019. I believe 35 students took the test, but we did not have 100%. I think we were at 97 or 98%. But you can see we usually are with the first time average with most throughout the program. Summer employment or summary of employment data. Again, we're talking about rural communities. And we also teach our program based off of primary care. We teach you about the subspecialties, but it's very limited. We want to teach you a very broad base of medicine so that you can go out and take care of any patient that's out there. So we have from 2014 to 2018, almost 26% of our students have gone back into primary care. 24% of them are working in a rural community, and 56% of them are back in their rural hometowns. And that's a big accomplishment for us in our program, is that we're recruiting students, prospective students from these small rural communities that are going back to those small rural communities and helping take care of, their hometown. All right, so now I'll open it up to you. Lindsay, Jason, please feel free to answer questions. I'm actually gonna stop sharing this. That way I can see things better. Does anyone have any questions about the program itself? Have questions specifically for the two students? Remember, these students will also be part of the student panel, so you can ask questions there, but we specifically wanted them to be here to answer your questions in regards to the PA program in general. Please unmute yourself. You don't have to type all your questions in. You can actually speak. I'm totally fine with that. One person has a question. There's 28 of you on here. Does anyone have any questions for Maggie? Like I said, Maggie is part of admissions, so if you're worried about your CASPA application, any questions about interviewing, we do MMI interviews, and from what I'm told, we are continuing with MMI interviews for the next class, but we'll just be doing it virtually.
Yep, that's correct.
Okay.
Yep. So I know since you guys don't have questions yet, maybe I can't, a lot of questions that I get, I'll kind of, list off some frequently asked questions. A lot of people ask questions about clinicals. Where are clinicals? How long are they? I guess the biggest question is where. They're all in New York State. If you want to elaborate on that a little bit.
Sure. So clinical rotations, there's 11 rotations in June. Of 11, 9 are mandatory. So the mandatory rotations are outpatient internal medicine, inpatient internal medicine, emergency medicine, general surgery, pediatrics, OBGYN, behavioral medicine. I always forget a few. Help me out. ER, dental surgery, behavioral, long-term care. Did I say peds? Okay. Well, and then 2 are electives that you get to choose of your liking. It might be going back to a site that you want to think about. That's where you're going to take your career. It might be that you're using it as almost like a job interview. So places that we send students in New York State, there's no guarantees. Every year the sites change. There are students that stay in the Syracuse area and will travel within about a 45-minute to hour time frame around Syracuse, so they can go to Rome, they can go down into Portland, Auburn. We've had sites in Oswego. We use the Syracuse VA for a site. We've had sites in Watertown, Geneva, Olean. I believe they've developed a new site this year in Warsaw. I think that's over in the Rochester area somewhere, I believe. We have Utica. We've had students go into Amsterdam, which is down by Albany, I believe. We've had students in Columbia Hospital, which is down in Columbia, which is south of, I believe, Albany. We've used Ogdensburg. I've used a lot of places, some aren't available, some aren't, and again, I'm not the clinical coordinator, so I don't sometimes have access to know what's being used and what's not being used, but they definitely are out there always looking for new sites and taking new sites in and trying to keep the sites that we have because they are very receptive to taking our students, and they're all in these small rural communities.
Awesome. So if anybody has questions, please jump in, but I'll keep going. So Abigail has a question. What are some of the prereqs that are required to be considered for the program? So Abigail, that's a great question. And all the prereqs are listed on our website. There is quite a few of them, but I can link it in the chat box here. So you guys can kind of have access to that now. And while I'm doing that, another question I get a lot, and this is for the students, what is it like transitioning from college into PA school? So a lot of times people have a transition from high school into college, studying wise and things like that. How is that from college into graduate school?
actually graduated from undergrad and came right into the program. I only had like a 3-week or like 2.5-week break from graduation to coming into Upstate. So, I mean, depending on where you went to school and like how you studied is going to vary. I mean, for me personally, like it definitely was a lot more intense. Like you definitely need to put in the work for it. Like you're going to be studying a lot more. I mean, it's not like undergrad. You're in a graduate professional program, so there's a lot more that goes into it. So I guess that's the only thing that I can really say towards it. So.
I guess for me, I graduated in 2017, and I had New Year. That's when I got my clinical experience and my regs done. And I basically have to say the same thing. Like my studying habits from college definitely changed. You know, trying to absorb a lot more information, trying to figure out like what's more important, and more like time management. I think it's for everyone. But you will eventually like figure it out once you start the program and everything. You have everyone there to help you, the faculty. And
Awesome. Yeah, our faculty is awesome.
so someone mentioned, can you please tell us what your most memorable clinical rotation? So we actually start rotations at the end of August, so we don't know yet.
Great, thanks for the question, Callie. Abigail asks, also for the current students, how was the CASPA?
So that was difficult. When we first start, it's like, what is this kind of thing? But once you break it down, like, what are they asking from you? Like, okay, so clinical experience, paid experience, your resume, like it breaks it down in a way that it's confusing at first, but as soon as you start, getting all your prereqs done and all that stuff done, it's basically like, what is that thing called? The Common App. It's basically like for PA schools. Most of them go through CASPA. Some of them don't. I know Downstate does not. That was a bit aggravating, but most schools go through CASPA, and it wasn't that bad once you start like putting things in.
And you definitely want to start the CASPA as early as possible. It's definitely not like a 2-day thing. I know I worked on mine for like a couple weeks, and you have to like send out like a link almost to like people that are going to give you like a letter of recommendation. So it's really important that you give those people notice too, because they can have like technical difficulties. So definitely start it as soon as possible.
Yeah, on piggybacking on that, I highly suggest like having some sort of guidelines, or maybe just starting ideas for your personal statement. I think that's the thing that took me the longest. I think I started in like January just to like write everything down, and I think the application opens up like mid-April, I think, from when we started.
Yeah, end of April. This year was April 25th.
Yeah, so definitely like as soon as that application opened up, you can also submit it the same day it opens up. So again, as soon as you can, submit it. A lot of programs are like first come, first served kind of basis, or rolling admission, that's the word.
Yeah, so just to speak to Jason's point really quick, we do work on rolling admissions here at SUNY Upstate, so it is advantageous to get your application in earlier than later. I usually recommend if you can apply during the summer before you want to come. So if you're applying for summer 2021, you'd want to get your application in sometime during the summer months of this summer 2020. CASPA does take a while. It can take 6 to 8 weeks from the time you start filling it out until everything's verified. And once everything's verified, then we send you login credentials for a supplemental application. But just take your time on CASPA, make sure you're filling it out correctly. I will say, I've had to reach out to CASPA before. They always respond back to me within 24 hours. They're super responsive. If you have a question about how to submit AP credits or have a question about transcripts or letters of rec, just reach out to them. You can also always reach out to you can reach me 100 times if you need to when you're filling out your application. I'm always happy to work with students. I'm always happy to help you with CASPA or your supplemental or make sure everything's in. People always tell me, oh, I don't want to email you, you're so busy. That's literally my job. So please email me, call me. I'm always happy to help my students.
Yeah, so going on that, like prepping your application and everything, just make sure, like she linked the website to the prereqs and everything. So just make sure it aligns with that. You have the prereqs ready. That was the one thing I guess I should have done earlier, because I was taking AP too while I was applying. I didn't know that. So I was like, taking it while I was applying. I'd rather just have it, done before I apply.
And you can always reach out to me. You'll get an email after today thanking you for coming to this event. And I'll do pre-advisements with anybody next week, one-on-one through Zoom or a phone call, not in person right now, but always happy to meet you to kind of talk about your application, make sure you have your prereqs. I can look through your transcripts, give you advice on who to ask as a letter of recommendation writer, anything like that. So I do, I actually do probably about 5 pre-advisements a day, if not more, so always happy to meet with students.
Answered Abigail's question, but
Jason and Lindsay, Kaylee asked a question about how was your experience adapting to the rigorous coursework at the start of the program?
So Upstate does a pretty good job with introducing you to the vigorous amounts. So like Karen said, that we take EKG, anatomy, and population medicine and professional issues. So it's not a giant course load compared to fall and spring semesters and so on and so forth, where you get to experiment like with your time, figuring out what are the times you can take breaks, what are the times you study, hanging out, trying to get yourself accustomed. And I think Upstate did a pretty good job with that, where I was able to figure out how to basically, and it's different for everyone.
Yeah, I definitely agree with that. Like the summer is like a really good time, like when you're first starting to figure out like how you study best, like if you like group studying, if you like doing it by yourself, and it's kind of like a precursor to like the workload that you're going to get in the fall. I mean, it definitely is a lot. Like there's no going around it. There's no like sugarcoating it. But definitely like make sure that you have time like for yourself. Like take a break. Breaks are super important. Like Fridays, like after class, like I don't do anything on Fridays school related. Fridays like my day just to like relax and gather your thoughts. So it's definitely important that you manage like a time frame to do that as well.
I agree with them both very much. You have to take time for you. You have to reflect on yourself and how you're doing throughout everything. Your mental health is just as important as getting the material down. And if you're not taking care of yourself, you're not going to be, your work it's going to show in your work. So you have to take that time for yourself and you have to budget. You have to be very goal oriented and you have to be very on top of your stuff. And you have to know, like Jason and Lindsay have both said, how do you budget your time? How much do you put into each class? Anatomy is very intense. It's 5 days a week. It's lecture and then lab. You're doing a lot of your own dissection. You're testing every other week. It's all of anatomy in 8 weeks. So that's why it's 9 credits. It's doable. You've got to be able to put the work in and you've got to be able to, know how you're going to budget your time. And then like Lindsay said, take time for yourself to say, you know what? I need hours away from this. I'm going to go out to dinner with my boyfriend, my girlfriend, my friends. I'm going to meet up with some of my classmates to get to know them better. And then I'll start again 8 o'clock Saturday morning or whenever I'm going to get ready to start for my next day.